Hello and welcome to Restorative Resilience Clinical Supervision. Do you want to improve nurse and midwife retention by addressing the causes of compassion fatigue and burnout? The demand for nurses and midwives in Australia is high, but they lack adequate support and face challenging working conditions. Current and projected shortfalls in the caring professions have resulted in overwhelming workloads, reliance on temporary staff, workplace harassment, violence, vicarious trauma, and ultimately burnout. Nurses and midwives are well positioned to offer trauma-informed care to prevent re-traumatization, promote compassionate care, and respect individual autonomy. There are various methods through which nurses and midwives can integrate trauma-informed care into their practice. However, no specific clinical supervisory model is typically preferred for integrating trauma-informed care clinical supervision for healthcare professionals. The aim of this talk is to explicate the implementation of restorative resilience clinical supervision as a trauma-informed care intervention for nurses and midwives by healthcare services and hospital administrators. Integrating this model of clinical supervision into practice offers an opportunity to mitigate the effects of vicarious trauma, compassion fatigue, and staff turnover. Nurses and midwives caring for distressed patients in complex environments face challenges which impact their professional quality of life. These impacts include the risk of vicarious trauma, the burden of compassion fatigue, increased sick leave rates, burnout, and higher staff turnover. Nursing and midwifery staff turnover in high-stress, high-demand contexts are attributed to various factors, with inadequate support and burnout emerging as significant contributors. Clinical supervision has many definitions, which are as varied as those of healthcare professions. The following definition has been chosen for clarity. Clinical supervision is a formally structured professional arrangement between a supervisor and one or more supervisees. It is a purposely constructed regular meeting that critically reflects on the work issues the supervisees brought to that space. It is a confidential relationship within the ethical and legal parameters of practice. Clinical supervision facilitates the development of reflective practice and the professional skills of the supervisees through increased awareness and understanding of the complex human and ethical issues within their workplace. Restorative resilience. Clinical supervision is a model of clinical supervision independent of operational and task supervision. The Restorative Resilience Clinical Supervision Workshop, provided by Deborah Clagues, has been endorsed by the Australian College of Mental Health Nurses. This model of clinical supervision focuses on broad themes of compassion satisfaction and trauma-informed practice and explores the essential nature of nurses and midwives whilst encouraging their professional growth and resilience. Restorative resilience. Clinical supervision is not therapy, and personal and professional practice boundaries are identified. A referral is suggested whenever personal counseling is required. The purpose of restorative resilient clinical supervision is as follows: to enhance positive outcomes for nurses and midwives providing trauma-informed care in high-stress, high-demand healthcare environments. To encourage continuous professional development for nurses and midwives. To support nurses and midwives in managing the demands of the job by providing a safe place for reflection. To provide compassionate listening and support in a safe and appropriate manner where the demands of the job may exceed staff capacity. To ensure that health and well-being issues at work are addressed. To allow nurses and midwives to explore their fears and learn new ways of communicating and building confidence, which will enhance individual interpersonal skills and pro-social behavior. To enable nurses and midwives to have a dedicated space where the impact of vicarious trauma can be mitigated, and for them to use this forum as a protective factor against stress. To support nurses and midwives in the development of leadership and advocacy skills. The evidence supporting restorative resilience clinical supervision comes from quantitative research in the United Kingdom, where implementation was associated with greater compassion satisfaction and reduction in burnout for nurses and midwives. The initial study investigated how caring for families experiencing miscarriage and neonatal death affects midwives to determine whether restorative clinical supervision can decrease stress and burnout while increasing their professional quality of life. The goal of the research was to gain a deep understanding of how traumatic birth experiences impact midwifery staff and to develop effective strategies to help them manage the emotional demands of their work. The Professional Quality of Life Scale assessed the impact of restorative clinical supervision on the compassion satisfaction, burnout, and vicarious traumatic stress of 350 maternity staff. Despite over half of the midwives reporting high stress levels initially, the introduction of restorative supervision proved beneficial. It improved the staff's resilience, effectively reducing their stress and burnout while enhancing their compassion satisfaction. Further research was undertaken with large groups of nurses, doctors, and social workers. On average, burnout was reduced by 40% and stress by 62%. The findings underscored the trauma-informed care outcomes related to the use of restorative resilience clinical supervision for nursing and midwifery staff. This model of clinical supervision not only equipped nurses and midwives to manage the emotional demands of their work, but also enhanced their professional quality of life. In Australia, educational interventions such as the Promoting Resilience in Nurses program have shown promise in enhancing the capacity to manage stress, regulate emotions, and foster post-traumatic growth among mental health nurses in the face of adversity. Introducing this model of trauma-informed care clinical supervision to healthcare professionals can be challenging. Therefore, it is essential that the organization provides systemic support for restorative resilience clinical supervision to succeed. 1. Commitment from leadership. Every level of the organization needs to be engaged and consistently dedicated to the provision of restorative resilience clinical supervision for nurses and midwives. Commitment to restorative resilience. Clinical supervision is crucial. Not only must the supervisor and supervisee prioritize it, but its scheduled time must also take precedence over workplace obligations to ensure that clinical supervision can flourish as a method of staff well-being and professional development. 2. Support for supervisors. Supervisors must receive supervision from qualified restorative resilience clinical supervisors. The supervisors providing supervision for supervisors must be educated in the supervision of supervisors. 3. Trust, privacy, and protected time. Building trust is crucial in creating an effective supervisory relationship. For the successful implementation of restorative resilience clinical supervision, supervisees should trust that the information they share is private and that their work in supervision contributes to their professional growth. This trust is facilitated by setting aside time and a private space for supervision for nurses and midwives. Dr. Deborah Klages is an accomplished psychiatric mental health nurse, researcher, and educator. Her professional focus lies in facilitating clinical supervision workshops, utilizing an Australian adaptation of the restorative resilience model of supervision from the United Kingdom. Deborah's future research goals are to gain a deeper understanding of clinical supervision interventions that improve compassion satisfaction, post-traumatic growth, and prevent burnout within the caring professions.